Hi, today we have with us Dr. Varun Nambiar, who's going to talk about Instagram for dentists. That is, how to grow your dental practice using Instagram. He has more than 75,000 followers on Instagram and is the right person to tell you the tips and tricks about it. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.
Hello, myself, Dr. Varun Nambiar. I have been in private practice since 14 years. I did my BDS from Vinayaga Mission Dental College, Salem, way back in 2002. Then I started my own practice in 2008, so it's already like 14 years down the line. So in between, I did my master's in business administration from Manipal. Then I went on to pursue my MDS in maxillofacial surgery from AJ Shetty, Mangalore in the year 2012. 15. So after my 5 years of private practice, so I practice mostly, concentrate mostly on facial aesthetic surgeries like rhinoplasty, then autoplasty, then all injections like botox and fillers. So I'm more into facial aesthetic procedures rather than dentistry right now. So and more of a kind of implants. So that's all about me. Thank you.
Hi, Dr. Varun. Thank you for joining us today. You're a lovely person, and once I met you personally, I realized the enthusiasm, the energy you bring all around you is truly amazing. So, thank you for taking off your time from your busy schedule to join us.
That's so sweet of you, Satish. Me too felt the same vibe. I'm so happy that I got to meet you. But I say that it's been late, a little bit late. We should have met before. That's what I feel.
100%. We should have met before,
Uh-huh.
but better late
Yeah,
than
yeah,
never.
yeah.
So, my first question for you is you jumped into the social media bandwagon, the Instagram, everything. When people used to think it is fad, it is silly, why you should get into that, normal face to face marketing and networking works. How did you realize before others Instagram and social media is the way to go?
See, I started my social media drive. In fact, Instagram was the last one I entered. So I started in 2000, way back in 2015 when I finished my
Oh,
PG and came out. So that time, when you see, the fact was that nobody was there on social media, very much active, doctors, especially doctors. So I thought, okay, fine, that's the platform where I should market myself. Why? Because I want to create a space for me. So there are lots of people out there who are far better than me in their practice and everything, but they had already made their kingdom. So where am I, a fresher? Not a fresher as such, but still a recently passed out MDS guy, where he has got the space. So I found out that social media is the best platform to exhibit what we do. So firstly, I started in Facebook way back in 2015. So I tremendously, my posts were like going in case in lakhs and all. So I was really happy. My patients started pouring. Then I started increasing my numbers of staffs and all. Why? Because the volume started increasing actually.
understood.
So that time also, the seniors or whoever is known to me, they used to mock at me. Ware yaar, you are like what bullshits are you doing on social media and all? But I was okay with that. I used to take it in that very jovial way. But I was very aggressive in my marketing. Marketing in the sense, I started posting whatever I do. I don't
Understood.
market as such. I didn't use any advertisement tools, or I didn't pay, or I didn't pay someone to market me. I just posted what I was doing on my daily routine, whatever I do. Even a tooth extraction I used to post, a smile designing I used to post. But there was a space for every post, whatever I did. So
Understood.
and it turned out to be a hit. So when Facebook was there, I was there in Facebook. Then came Instagram. So I realized that Instagram is a newbie, so I have to be the first runner in Instagram when all others enter it. So by the time I entered in Instagram, I didn't had any idea what Instagram was, but I started posting stories. That too is a fun. I was asking my brother-in-law, "Arey yaar, how to post a story, yaar?" So in 2016, when I was dropping him into airport, he told me, "You have to take every bits of the moment and just post it as a story." That was in 2016, and today is 2022,
22.
and still
6
I
years
am
and you're
there.
consistent.
I'm very, very consistent in posting my stories. I haven't, you cannot see me without posting a story in a day.
Understood,
So
but
in
I
this
just
six
want to know,
years,
how are you so consistent? A lot of people end up dropping out once they have a lot of patients, managing practice, managing patients, so many staff you have. How do you maintain that consistency?
see, if I haven't tried without posting stories, but I believe that. So whenever you feel like okay, ho gaya, mera kaam ho gaya, I'm relaxed now. It's time to relax. Your failure starts there. So the biggest success mantra in my life is consistency, and I keep on doing that. And you have to be like very very aggressive. Why? Because right now I'm getting aged. The new youngsters are coming up. They have like tons of caliber than me. Whoever is watching me, they will be like born with tons of caliber. So to match up with them, I have to be like aggressive. I should not sit back and rest like the old beast. So I have to be like very aggressive to cope up with them. So I'm not going to go back until next 10 years. So I'll be very
So all
active
the youngsters,
there.
be ready. Varun Nambiar is not going to
Yeah,
stay and he's going to give you a competition.
yeah. I'm not going back.
So now you told me about consistency, and you post a lot of things. You post cases, you post reels, you post videos. Okay, how do you know which content works and what type of content you would suggest someone who's just starting out to keep posting? Before you listen to the answer to that question, if you're enjoying this video, please do not forget to hit the like button below, because the guest out here has taken time from his schedule to come and help you out. And I'm sure you're subscribed to our channel, because if you want to take your career to the next level after BDS, this is a channel you need to subscribe to.
The best part is this is a very serious thing which is going on in everybody's mind. Which content clicks? So, my dear friends, I just have to tell you one thing. Every content is a clicking matter in that. You don't have to break your head to search for contents. I'll tell you. What is the color of a teeth?
Right.
What is the basic color of a teeth? So it's not white. It's not white. Okay. So there's a content in it. You can talk on the color of a teeth. So what is oral hygiene? That's a basic of the basic thing in dentistry. For you take, for example, if you take, so you can talk about the oral hygiene, how to brush the technique. There are lots of animated videos stating how to brush, but there is a content in it. So every single topic from top to bottom, if you take in dentistry, there's a content. And if you search on it, there is not much people who had given lectures or given informatory videos on such things. So take every single topic in dentistry. So if you ask me, I haven't done too much of dentistry topic till now. Why? Because very previously, that is way back in 2015 or 2016, I used to post lots of videos on dentistry. But right now, I am switched on into surgery. Basically, most of my videos are based on surgeries and facial aesthetic procedures. So if you want to create a content in dentistry, for example, every single topic you take is a content. So you don't have to
Understood.
go and search for contents. That's the
So you
basic thing.
find whatever
And
you're doing in dentistry and convert it into a content, basically.
yeah,
Understood.
that's my only what is that only what is the takeaway message. Don't search for contents. Whatever you do in life, I not only post only my, so what is that, informative videos. I'll be dancing in social media, I'll be eating on social media, I do everything in social media. So there is content in everything. So even if you jump from a mountain, there's a content. So do it. Only
Understood.
thing is that don't be reluctant, do it.
See, you
Feel
have
free to
this
do it.
energy, you are comfortable doing everything, okay? But I have seen you have made your staff also do all these things. And I'm sure a lot of
Yeah.
them would not be initially comfortable. So, how did you
No,
get
no,
the
no, no.
buy in and convince them that this is what they should do? How did you do it?
See, I used to carry one, what is that, stick with me. I used to beat them. That's no. See, basically, what Satish, this one serious thing. Okay, so how I made my team grow. So basically, most of the doctors, whoever, I'm not generalizing it. So most of the senior doctors who I have seen is that they call their colleague doctors as juniors. They don't have a name, they don't have an identity, so their performance will be actually little bit down. What I ask them is that you should yourself create a brand of yourself. Okay, all the junior doctors, whoever is working with me, they have a brand. Their name should be branded. So once they become a brand. In a way, people will come searching for them. I believe that they are not going to leave me. If at all they are leaving my center and go, that's okay with me. But still, I make sure that they should be a brand of themselves. So I motivate them. Arey, yaar, post your stories, post your content, post your video, so that their identity will be increasing. So in a way, they will also like that fame or their identity. Got it? So I motivate
Understood.
them and I make sure that everybody. But not everyone is posting stories. Why? Because I think I will be the only one who is very consistent. Even the youngsters who are working under me are not so consistent in posting stories. But still, I ask them, try to post stories, create a brand, create a brand value. Let the whole world knows you, or your relatives, your friends. Let them also know that you are a doctor. Talk on your subject. So I motivate them. Most of the thing is motivation. And end of the day, when the viewers start increasing, they will also start loving it, their identity.
Understood. So basically, you're
Ah,
convincing them to grow together. So as they grow, you will grow, everyone will go together. That's
yeah, yeah.
basically how you motivate them.
Every doctor who is working under me, they have their identity. They are not like junior doctors to me. They are like
Understood.
they are like my teammates. So I don't call them my junior doctors. Actually, I can't read out the names of my teammates. So they are my
Understood.
teammates. So I call them my teammates, and they are trying hard to create their also brand. So I'm happy with that.
Understood. You have told me in the start that when you did all these social media and everything, you never got into advertisements, you never pushed your content through sales and everything. Do you advise someone who's joining Instagram or starting right now, they should invest in Instagram ads or anything, or just organic is the way to go about?
No, previously, if I say organic was my thing was only organic. I never did this sponsoring my post and all. But right now there are too many doctors. Means lots of people have entered Instagram and social media right now. So if you open the Instagram, you can see lots of people doing sponsorship and all those things, and they are getting pretty good reach. So initially, in this current situation, if you want to get a space for yourself in the social media, it's always better if you can invest a little bit of money. That too is not a huge money as such. Okay, so investing on big stuffs in your clinic, and you're not investing on social media, that's the worst thing, I'll say that. Try to make sure that you make a checklist of your contents, to whoever is there. So make your contents very consistent. You post it on not on a daily basis. Stories you can post on a daily basis, but reels or informatory videos or informatory reels or YouTubes and all. So you make a contents. Make sure that you list it out. And this week I'm going to post two contents. The next week I'm going to post two contents. So when your contents, when you have a real charm in your content, definitely you will get an organic reach. You don't have to search for contents and all. But make sure that you present it in a very good manner, that the person who is watching them or listening to you is feels more interested in watching more of your contents, so they will keep on searching you. And I've seen lots of
Understood.
people right now. One dermat, she's my colleague. So I motivated her to start posting stories and what is that, reels about the dermatological stuff, and she's a huge hit now, better than
Great.
me. Yeah, better than
Great.
me. Why? Because her contents are like so super, and she narrates it really well, and I'm so happy with that. And she's like a huge hit now. So I think I should better learn from him, right? Why? Because she was very consistent in posting her contents. So
So basically,
contents,
it
if
is
you're
good content calendar. The quality also should be good, and then consistency. So the match of all three is what you
presentation,
should do.
presentation should be good. Everything should be good.
Understood.
And
Uh,
invest on it. If you don't have a good mobile, invest on a good mobile rather than investing on it. What is that, 10 lakh rupees big chair or a dental chair worth 10 lakh rupees. I'll tell you, invest for 3 lakh rupees on a dental chair, and then invest 1 lakh for a good mobile or a good camera, so that you can reach out to the bigger crowd actually.
Understood. People do not spend on marketing and everything. They do not spend on getting their branding out there, but they just spend on
No,
the
no,
clinic stuff and assume people will come to them. So they have to equally spend on both. That is something which the younger generation needs to realize.
Yeah.
Understood. Now you think all this should be done in-house, or would you advise some of it to be outsourced? Maybe the videos, the editing. How would you advise them to go about it?
I personally believe that you should learn everything by do yourself. Okay, why? Because it's always difficult when you are dependent on someone actually. So for every content you may have to call him. He has to sit down. Then your whatever you are thinking, he won't be understanding. Why? Because the one who is doing won't be a medicus. He might be a non-medicus, so he won't be knowing what exactly is going on in your mind, the content, the where it has to reach. So it's always better. It's very simple. There are lots of apps right now in your mobile. You don't have to have a laptop either. I don't have a laptop. Just very recently I bought a laptop for your kind information. I just very recently bought a laptop. So I don't have a laptop.
I've
Whatever
seen
I
the
have done is
unboxing
from my
video.
mobile. Yeah. So so whatever I have done all these years is through my mobile. So it was a very small mobile. So as time passes, as very good new mobiles comes, I try to update it, not on a bigger thing, but I try to update it, so that all you need is a mobile. I don't want you to have someone who is going to help you. You can take tips from others, but better, it's always better you only does it.
Understood. You have given a lot of points in a short duration. Like you should start with Instagram, you should go to social media, what type of content, how do you maintain consistency, doing it yourself, whether you need to use ads or not. Other than all this, if there is a young dentist watching this, what would be your advice to them who's just graduating from BDS right now?
First thing, to all the dentists or the young freshers out there, stay away from negative people. First thing, okay? So basically, there will be like thousands out there to demotivate you, saying that dentistry is the worst ever decision you had made in your life. Please don't listen to them, okay? So dentistry is almost like this. What is that wallpaper? It's a gold mine. Okay, it's all gold in dentistry. The only thing is that you should find your space. So keep your eyes open, start observation. You should observe what exactly is going to do good to your business or your area or your town, where you're going to settle down, and find out your passion, whether it is aesthetic dentistry or whether it is anything related to orthodontics or Invisalign or whatever. So take one or two topics in dentistry, be a master in it. Either you can go for MDS, and after MDS also you may have to master in every single topic, but find out a space for you, start marketing, go out to the world, be aggressive, be aggressive. There is no space for slow players right now in this world. Okay, you have to be like aggressive. So start marketing yourself. There is nobody who is going to market you. Only you yourself have to brand. You yourself have to be a brand ambassador. Understand that. Start marketing. Take one topics, lecture on it. People will say that, okay, this guy X or Y, he is the one who is doing only aesthetic dentistry right now. If you see Instagram or social media and all, I keep on watching youngsters performing. So I've seen very new entrants into dentistry. They are performing really well in some very good topics. Like if some select like facial aesthetics, they are doing pretty really good in facial aesthetics. How they are doing really good is that they are marketing themselves as in that topic. So their contents are really good. What I say in related to social media, okay. So when their contents are really good, in a way they will be start getting patients. So what I tell you, my takeaway message to my friends is that rather than investing 1 crore or 2 crores in your clinic, or 50 lakhs or 60 lakhs in your clinic, invest wisely. Okay, then always update. Why? Because most of them, the problem with most of the youngsters is that they are not updating their subject. So every now and then everything is coming up, every other morning new thing is coming up in dentistry. Okay, so update yourself. Why? Because being a professional, you have to, your knowledge is your investment. So start investing on new topics, so new doors will open. And be positive, always positive. Do stay away from negative. That's what from the very beginning I'm telling. Always be positive. And and your business, sorry, your dentistry, don't take it as just as a clinic or doing seva to the public and all. Take it as a business thing, and be very professional in your business aspect. Why? Because what I do is that I have a statistical analysis. I have a statistical analysis about the patient outflow, the number of cases coming, how the graph is growing, is it coming down, is it going up. So your approach to your dentistry should be not like the same stereotypic approach that I'm doing. Say, what is that? I'm doing a health sector. Clinic, I'm treating patients. I'm doing good to the patient. Yeah, you are doing good to the patient, but at the same time, your approach to your practice should be like a business aspect. So it should be like more of a kind of a management stuff. And learn management also. I'm telling you, all the doctors don't go and learn MBA and all. I'm telling you, if there is some crash course or some courses where which are providing management studies, how to double your business or something like that, invest on that. Some one or two topic tips you will receive, and it will also help you. So do
Understood.
management studies. Do management studies.
So your basic takeaway is stay away from negative people, focus on dentistry, keep upgrading yourself, but even look at the other aspects. Just don't think about dentistry aspect. If you're putting a big clinic, take out time, do branding, market yourself, go to people out there and keep learning about the management so they're just not sticking to dentistry, but you're growing as well. So it
And
was
one
a,
more thing,
yeah, sure.
one more thing, and one more thing. Make a good network. Network in the sense, youngsters who are coming to a town, a new town, they are going to start a practice in a new town. Create your own network. The network in the sense, join some organization like Rotary, Lions, JCI, Vice Men's Club, whatever, a cycling club or a gym club or whatever. So that will lead, that will give you some lead to some people out there, and you're creating a network. So in a way, that will also help you to grow your business in that area. So always invest your time for networking. Why? Because if you see the whole world, it's the right now it's all networking. So if you have a huge network, you have a huge business. So invest your time for making a good network. Thank you.
Understood. It was lovely that you've taken out your time and you've come and shared with the young dentists here the various ways they can use Instagram to grow. Thanks a lot, Dr. Varun. Thank you for being here.
Thank, thank you so much for inviting me. And Kaizen Dental, I came to know about you a little bit late, but right now I'm getting a very good picture. Why? Because lots of youngsters who I make conversation with them, they are telling very good reviews about this Kaizen Dental. That is what after BDS and all. So very recently I met someone. So she was telling me, why? Because all my guidance is from Kaizen Dental. So you're doing a great job. So
Thank
all
you.
the very best for all your future endeavors.
Thanks a lot. Thank you.
Thank you.
If you like this video, you would surely love our video on marketing of a dental clinic. Do not forget to go and check that out.